The first topic in our back pain education series is on physical activity and the benefits of exercise. Whatever your age, there is strong scientific evidence that being physically active is beneficial for both your physical and mental health. Physiotherapy helps people engage in physical activity in a safe and supported manner. However, we also appreciate when experiencing back pain, there might be a tendency to avoid exercise or physical activity, as you may think it is harmful. As a result, some people can become deconditioned due to long-term inactivity, which can be perpetuated by unhelpful beliefs, such as that exercise and physical activity is harmful. This slide highlights the cycle of deconditioning. What it shows is that when some people experience back pain, they might do less or they may avoid the painful activity, which can result in detrimental physical and emotional changes. Physically, your joints may become stiff and your muscles may become weak, leading to reduced capacity to do normal activities of daily life. You may also experience low mood, anxiety, and less confidence in your ability to do things. This may potentially lead to increased pain, perpetuating a continuous cycle of deconditioning. This is something we want to help you avoid. Research indicates that increasing physical activity gradually when suffering from back pain can improve your ability to do everyday tasks. Furthermore, doing exercise you enjoy and are comfortable with might reduce pain. Being physically active can activate our body's internal pain-killing system through the release of chemicals called endorphins and enkephalins. These chemicals mimic the action of painkillers, but importantly, there are no side effects in comparison to medications. However, some people continue to experience pain symptoms after exercise. This often is due to an individual's body adapting to the new activity. It is normal for anyone who is not used to being physically active to experience some muscle soreness after doing a new exercise. The pain associated with exercise should gradually reduce as you become accustomed to the activity. Worsening symptoms may also be due to increasing the activity too quickly. Therefore, reducing activity levels a little and then gradually increasing again slowly can help some people cope better. As well as helping you cope better with pain, the health benefits of exercise for low back pain are numerous. Research indicates physical activity can reduce the frequency of painful episodes, improve your physical function, and reduce work absence. Wider benefits of physical activity include protection against the risk of developing chronic conditions such as heart disease, type 2 diabetes, cancer, stroke, and depression. It can improve sleep quality and reduce fatigue. Exercise can also help you lose excess weight and prevent weight gain. There are three main types of exercise which we should be aiming to do on a weekly basis. These are the 3 S's of exercise: stamina, strength, and stretching. Stamina refers to aerobic exercise, which is any type of activity or exercise which increases the heart and respiratory rate. This is important for many body functions, especially the heart and lungs. Aerobic exercise maximizes the amount of oxygen pumped around the body. Increased oxygen levels help muscles work more efficiently. Examples of aerobic activities include brisk walking, swimming, jogging, cycling, and dancing. Strength exercise is important for building muscle mass. Muscle mass is something we naturally lose with age, therefore regular strength training is essential to maintain muscle power. Strength exercise also helps keep bones strong into old age, improve posture, balance, and can reduce back pain. Example of strength exercise which could be done at home includes squats, push-up, lunges, and exercise involving resistance from a weight, a band, or a machine. Remember, it's important to feel some muscle fatigue at the end of the exercise to make sure you are working or training the muscle group effectively. And finally, stretching helps to maintain flexibility and it's vital that you stretch the muscles regularly to reduce tightness and prevent joint stiffness. Current physical activity guidelines for adults developed by the government clearly sets out the benefits of being active. It also provides recommendations on how much and what type of physical activity we should aim to achieve on a weekly basis. The updated guidelines in 2019 strongly recommend doing muscle strengthening activities at least twice a week, but that any strengthening activity is better than none. They also highlighted the importance of doing activities or exercise to improve your balance, as this may prevent falls. All adults should aim to do 150 minutes of moderate intensity activity, such as brisk walking or cycling, on a weekly basis. Please gradually increase your activity levels within your individual pain tolerances to prevent further injury or worsening of a pre-existing condition. If you are already active, the government recommends 75 minutes of more vigorous activity such as running, swimming or sports. However, we are aware that 150 minutes is not a realistic target for everybody, especially people with back pain. But the overarching positive message emerging from the guidelines is that it is better to do some physical activity, however insignificant you may think it is, than doing nothing. The least active individuals stand to gain the most from a small increase in physical activity. Final point to highlight from the guidelines is that we should aim to reduce our time spent in sitting, and when physically possible, to break up long periods of inactivity with some movement or light exercise. The key points to remember from the benefits of exercise is that being active every day provides a foundation for a healthier life, both physically and mentally. The least active individuals stand to gain the most from a small increase in physical activity. Muscle strengthening and balance activities should be done at least 2 days per week. Start small and build up gradually for a safe approach to starting activity, and small changes can make a big difference.